I struggle for the right words. Do I call it the new life-changing, the new groundbreaking, the new medicine for cystic fibrosis?
So you gotta breathe, 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 breathe. Let it go and let it be.
Okay, it's happening.
It's exciting.
Good morning, you guys.
Good morning.
Today we are sitting down. You probably can tell that we can't wipe the smiles off our faces. I have been on the new... See, I struggle for the right words. Do I call it the new life-changing, the new groundbreaking, the new medicine for cystic fibrosis? Up until this point, all of the previous genetic modifying medications that came out never applied to my mutations. If you're curious, my mutations are Delta F508 and V520X, which is...
Yeah.
Oh, wait, what?
Yeah, you're right. I always want to think it's 520F, but I think it's X, yeah.
Wait, is it?
I don't
No,
know.
I'm confused. V520X. I mean, that's what it is,
Yeah,
right?
I think so.
Well, if any of my doctors are watching, let me know which one it is. Which is a, minimal function?
I think so. Or I don't know. At one point I thought it was called a nonsense mutation, but it's not.
Right. So I think it's a minimal function
Yeah.
mutation. But all of that to say, I am 30 years old. I started the triple combo before it had the name Trikafta on August 2nd under the expanded access, which was previously known as the compassionate use situation. So it was before the FDA approved it. And when we started this medication, there were a couple of big unknowns in our mind. Will my liver handle it? And will it even work? They say that during the trial, people saw these amazing, huge jump in their lung function and stuff. And I guess we're just used to my body doing weird things.
Yeah.
Any weird side effects that an antibiotic could have, my body typically has those.
Well, and just in the last, especially 5 years, we just haven't seen much response to really any kind of treatment. I mean, it's been kind of just survival mode, going through courses of IVs, and I think we would, the hope is that it would stabilize her, and there wasn't any expectation of jump in lung function or
Right.
any huge response to medications. So I think going into this, we've said all along this journey, when we started it and leading into it, we were optimistic, but
Right.
very cautious.
Right.
Cautiously optimistic.
Yeah, and I think part of that is you want to stay realistic about it. You know what history has shown as far as my body goes, and this is a brand new, I've never been on a medication like this. This is not an antibiotic. This is not an anti-inflammatory. This is a genetic modifying medication. So all of that to say, we went into it really trying to keep our hopes pretty realistic. And this medication has blown us out of the water. The interesting thing is, the day I took my first pills of Trikafta, we sat on the exam bed in the hospital or in the clinic room, and we said some of our wildest hopes and dreams for this drug. And I think that there was some laughter involved because of how specific or hopeful I was. I was like, wouldn't it be amazing if there was less mucus?
And at that time, I think in both of our minds, it was, that's laughable.
Yeah.
That is kind of unrealistic. So we were saying, wouldn't it be amazing? But if it lessened it a little bit, that was kind of what we were thinking about.
Right. So here we are at 3 months, and honestly, all of our wildest hopes and dreams, it's better than that.
Yeah, we never could have imagined what it's done.
So here's kind of the scoop. My lung function has come up 15% in 3 months, and that's insane for my body.
Yeah.
It really is amazing. But even more amazing than that number is less mucus. I'm serious, guys. So much less mucus, which means less coughing, which means less energy expended on coughing, which means more quality of life.
Yeah.
I've heard some of the numbers that they throw out from some of the studies that the quality of life improves by 20 points or however they were numberizing that.
I'm not sure how that scale works, but
if we were to make our own scale, if they said, you know, how would you quantify your quality of life? How much has it improved? Like, what would you say?
what scale are we? I don't know what kind of numeric scale we're using,
Let's use
but
percentage points.
If it was percentage points, I'd say 100%. Like, it's just changed our lives, really.
I would say like 75%.
Yeah.
You know, like
Yeah.
acknowledging that CF is like, there is still 30 years of cystic fibrosis damage to my body.
And I will say that there's aspects of being on this drug that quality of life, like there have been some side effects that, you know, it was a trade, it wasn't a trade. It was a give and take. But all those are way low down here compared to the improvement.
Yeah, and so the main side effects that we saw, my body had quite a time adjusting. And we can't really put our finger on what it was, like specifically that shaky feeling.
Yeah.
So it was almost like a low blood sugar feeling. Now, I have had a lot more low blood sugars since being on it, but the shaky feeling I'm talking about isn't the low blood sugar. My blood sugar was fine whenever the shaky feeling was happening, but I would say that went away. It wasn't every moment of every day. It wasn't every day. But around like week 2, 3, 4, those were the most impactful. Whereas I was just feeling like so shaky that I was like, I might as well not even try to do the dishes because I'm so shaky.
Yeah, and I think and it's hard to like know what to associate with the drug, what to associate with simply a change in how Mary's spending her energy. And like, because in many ways with this drug has come some life change in that Mary's able to use her energy for things other than coughing. And so I think that, you know, she gets tired earlier in the day.
Oh my gosh.
Because her energy level and stamina is just, it's almost like a time or like a body clock change.
Yeah.
And
like 7 p.m., guys. I'm like, can we get in bed?
But it's like, and it's so interesting because it's like, in some ways, as you think about it, it doesn't seem like it makes sense because that she'd be getting tired earlier because she has more energy, but she's using her energy more effectively now.
And I'm waking up hours earlier.
It's so interesting. But all of this to say that there has been along the journey, I think, some like elements of Mary just feeling weird.
Yes. So the shakiness, it has gone away completely. A lot of hormonal changes. And my doctors are talking about that aspect of it because there's a lot that they don't know. So along with the hormonal changes comes some, I don't know if mood situations, like my mental processing of life.
I mean, I don't know that I'd fully equate it to when you're on steroids, but there is like that kind of mood swing. We do think in the last few weeks that a lot of these things that we noticed early on have gotten better.
Yeah, so I would say month 1 and 2 were daily noticing something's off, whether it's my mood or I'm shaky or I'm trying to think. There were some days at very early on where I would be like walking into walls, dropping things. I'm not a klutzy person. So those sorts of like random little things where it's like Peter was saying, something's a little off.
Yeah. And some of that, it's like, well, is she just more active and running into things because she's more, we aren't like diagnosing what the side effects are or anything. We're just kind of like
Observing.
looking back at the last 3 months. These are some of the things we've observed. I think we're at a spot now where in some ways I feel like we're just hitting that spot where the dust has settled of 3 months in, and we're just sitting back and being like, this is amazing.
Yeah.
It's changed Mary's life.
Like, I'll tell you this, guys. It's changing my life. I mean, I don't know what I was going to say.
I think that words can't describe the ways that it's changed. I think one of the things is, those of you who watch our videos on a regular basis or from time to time will see the difference that Mary's not interrupted by coughing fits. It does happen, but it's so much less now that it's when life is uninterrupted. There's just something incredible about that.
Yeah.
And her lung function isn't like, I mean, up 15% is amazing, but she's still got lung damage and all of that. But the quality of life that comes with less coughing is just, I mean, just from an outsider perspective, like, I know that it's incredible for her.
I think also I was particularly set up, my disease process and my set of symptoms pre the triple really set me up for seeing and experiencing a huge shift.
Yeah.
Because my body was just so full of mucus and my lungs like coughed so frequently. When that changed, it was such a huge visual, but experience change.
Yeah.
I have some friends who have CF and they are progressed as well, but their set of symptoms looks very different. And so when the triple is used on bodies like that, you don't see as much of a huge shift. Like, I went from coughing all the time to not coughing. And then I'll also this just came to my mind. That first few days on the triple, I wonder if I'll ever actually call it Trikafta. It's just the triple in my head. The first few days, I was coughing, I would say a little bit more than my normal, but I was bringing up a lot of that dark mucus, and I've heard that that's pretty consistent. Everybody has that first couple of days, and I'm sure that changes between patient, how long those first couple days of purge are, that your lungs are getting rid of all this crazy stuff. But for anybody who's out there who's like getting ready to start it, I would say give your body 1 month.
Yeah.
Don't make any, celebrate the things that you notice, but don't be discouraged if the first month has a lot of adjustments for your body.
And I think it's important to recognize, whether you're somebody with CF who's getting ready to take it, or you're somebody who's simply watching our journey, it's important to recognize that like Mary said, everybody's CF body is different, and everybody's symptoms of CF present themselves differently. And so because of that, their experience of Trikafta is going to be a different experience. And like Mary said, her symptoms were, we think, kind of the perfect storm of being able to see tangible benefits.
Yeah.
I really think that for people who don't see as many tangible benefits, like maybe Mary's story can be an encouragement that it's doing something behind the scenes.
Yeah.
I don't know. Like that even in cases where it's not as, maybe you don't cough up as much all the time, you're not going to see that benefit. But I think one benefit we're going to see long term is we're past the point where Mary would have needed IVs right now.
Yeah.
And so we don't know.
Meaning, in my past few years, every 12 weeks or so, I was like getting fevers and an increased cough and all of these daily symptoms of like my body needs IV antibiotics. We've already passed that timeline.
So I'm just thinking in cases where maybe somebody doesn't feel that tangible benefit on a day-to-day basis, it might be more the long-term distance between
IVs.
infection and I don't know.
And I mean, we could really sit here and talk about it for an hour, but of the little amazing things that we've noticed. But like one thing was I caught a cold about a month ago, and that cold went from like, oh, I think I'm getting a cold to like, wow, my mucus is ramped up and it's dark again, and like, what is happening? But I ended up going on 2 oral antibiotics, which my bacteria are resistant to, but you got to try something. And they actually worked, which is amazing because oral antibiotics haven't helped in years. So it's changing the way my body responds to medications, which is amazing because I would have needed IVs to get over that cold and the repercussions of that cold, but now orals worked, which allowed me to continue my life, which is amazing.
Yeah.
So we are just feeling really thankful that, I mean,
And just to think logistically about how that, like, Mary still has the resistant bacteria. But if you think about her lungs being a healthier environment or basically an environment where that bacteria can't get as much ground because there's less mucus, it kind of makes sense that maybe orals worked better or that in the long term we might have less or more time between infections. Is
it kind of like making my lungs less of a hospitable environment for the bacteria?
Yeah.
Because it's less mucus, so it's less cozy places for the bacteria.
I think that's totally the right way to look at it. And it's all because Trikafta is going in and making those cells exchange the sodium chloride in a better way, which makes less mucus, and it's amazing.
It's amazing what happens when your cells are working like they're supposed to.
So, guys, this is just us looking back on the last 3 months. If you want to go back and see some of these moments of realization along the journey, I'll put a playlist down in the description for some of the kind of, I think we did like 15-day update and 1-month update and some of those. So you can watch those or see that moment when Mary first took the pill and we expressed some of those hopes and dreams, and it's blown all of those out of the water. So guys, thanks for coming along on our journey, and we're simply telling our story as we walk through everyday life with CF. And
as always,
we'll see you tomorrow. Good night.
Don't you think